At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Constipation When the Going Gets Tough on Wednesday, August 20th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Dr. Tom Roselle Live. This is yours truly, and got a great program for you today, one that may make you a little uncomfortable, but then what we're talking about is probably making you very uncomfortable anyway. What am I talking about? I'm talking about the irritable bowel syndrome that's due to constipation. And the interesting thing is when you're dealing with being all plugged up, you're talking about basically a do-it-yourself program, or something that had helped you do it to yourself. And we're going to kind of shed a light on that a little bit, because there's so many of you listening to this program that are suffering from toxicity, if you will. Your whole body's inflamed, and you got a lot of abdominal cramping, and you don't go to the bathroom the way you should. You're just all blocked up. So we're going to really talk about what that means and why. There are specific finger pointing, and it's getting progressively worse. And I want to go over that with you. If you looked up, lifestyle and constipation, and now we're talking about, remember, irritable bowel syndrome. And if you look it up, it's going to be -C. They're getting very cute in how they're putting these things together. And then they go irritable bowel syndrome -C and CIC. What in God's name does that mean? Well, the last part means they really don't know what's causing it. It's one of these idiopathic syndromes. And so what does that mean? That's called chronic idiopathic constipation. That's the CIC portion of it. And that simply means they don't know. Idiopathic means it's there, but we don't know what it's for. And I call it, chronic idiot constipation, meaning that they can't figure out how to diagnose it. You have to ask the question, why is it there, to be able to fix anything? In my world, we're looking at the biochemical causes, the neurological causes, and, by the way, the emotional causes of anything that comes about. So let's dig into this a little bit. But before I do that, I want to invite you to the Roselle Center in August the 20th at 6 p.m. And Dr. Zhang and I, my boy in traditional Chinese medicine, many of you know him and have been patients of him. He's a great guy. He has the capacity, to do things that other people, kind of let go and say, well, it's not important. But when you combine Eastern and Western medicine, you get a result sometimes that is exponential. And that's who this man is. He's an amazing doctor. So join us. We will go back and forth. I will put my 2 cents in, as I usually do, and probably do some, some finger pointing relative to, did you know this? Did you know that? And, oh, by the way, this is this. And so we'll go from there. So I'm going to start out with something called gut feeling. Every organ system in the body has an emotional component. The large intestine and small intestine are no different. And if you go through and you look at naturopathic medicine, you go into Ayurvedic medicine, you look at traditional Chinese medicine and so forth, they subscribe an emotional component to every system in the body. And the intestinal system is no different. It has to do with feelings, and sometimes internalized feelings, or sometimes unexpressed feelings, sometimes incomplete feelings. So we'll get into that. That's actually a program that I should do just for that. But let's talk about this irritable bowel syndrome constipation, not the diarrhea, the constipation. But by the way, that irritable bowel syndrome diarrhea can be a problem, but most of that has to do believe it or not, with constant irritation of something that you're getting, but also parasites. But that's a whole different program. I will touch on that, and I'll touch upon why a lot of people are having those problems now post-COVID. Because as we know, and if you've read and you've stayed up with it, the vaccines, those of you unfortunately that were vaccinated during COVID, they were made with parasitic components and venomous components. And that's how they're affecting you. One of the ways that it's affecting you. But if you attend the class on the 20th, I will get into that and I'll tell you why. And we'll tell you how to differentiate it. And we'll tell you what can be done about it, because there's a lot that can be done and so forth. But let's start with very common situations, and it's called lifestyle. And a lot of us don't do much, right? And we just kind of hang out, we sit and we grab chips and we eat stuff that is really not very good for us. Initially, when you eat something that's bad for you, it can cause an irritability and it causes you some diarrhea. But if the more you do it, your body becomes desensitized and it actually goes the other way. And so subsequently, now you got this low residue food in your body. And if you look up there, you can say, well, increase your fiber. Well, what are you going to do with fiber? Fiber is, vegetables with life. You say, I don't like vegetables. I don't want to eat that stuff. But fibers and, bulky foods that are good for you. And by the way, chips are not bulky foods. And, so you don't eat a lot of good for you. You eat either, deli foods and, chips and low residue stuff instead of eating what you should be eating. And we're going to talk a little bit about that on that Wednesday evening too, by the way, 6 p.m. So here's the deal. Okay. Let's go into one of the most common causes across the board because of modern science. What does that mean? It's called drugs, my friends. It's called drugs, medications. So here's things that can cause constipation: antidepressants and mood stabilizers, tricyclic antidepressants. They're older antidepressants, been around for a long time. They're combinations of drugs. And then things that are to decrease the irritability of the gut. They're really anti-diarrheal drugs. And one of the common terminology is loperamide. And then you get seizure medications, and you get anxiety relief medications like clonazepam, allergy medications. Ladies, because of urinary incontinence, you go out and the doc say, well, take this. And that has a lot to do with hormones, and nobody's touching your hormones. It's oxybutynin is a very common one. And then you get atropine, something that controls the heart and heart rate. And then Parkinson's medications and things that help mental stability. They're called antipsychotics. Instead of looking at the neurotransmitters and seeing if you can stabilize those, severe schizophrenic medications like clozapine, and then other things of that nature. I mean, the list is huge. It goes on everywhere from diuretics to anemia drugs, and even NSAIDs, your aspirins and Motrins and things of that nature, and anything that regulates the heart and pregnancy, and pain medications, particularly gabapentin, which is extremely addictive, oxycodone. It's a strong opioid. And then other pain measures, the hydrocortisones and the codeines. And how many of you, have I hit your medication yet? And then anticonvulsants and muscle relaxants and bowel regulators. And they all have bowel regulators. Yeah, when you try to, fix the diarrhea, guess what the side effect is? It's called constipation. And now you still have that irritable bowel syndrome that nobody can figure out where in God's name is it's coming from. So you have major input from what we call iatrogenic problems, not idiopathic, by iatrogenic. What does iatrogenic mean opposed to idiopathic? Iatrogenic means physician induced. They cause the problem by writing the wrong script and not monitoring or stacking medications over a period of time. So if you have moderate to severe pain in your gut, and you could have had, it could have been induced by surgery, and I'll tell you why in a second. You've had an opioid prescribed for you, and now you're on things like morphine for a short period of time, or oxycodone, or tramadol, I mean, the list is like crazy. One of the primary and almost anticipated side effects is constipation. So now they're going to stack it and they're going to give you something, hopefully, to break the constipation. It's not that it's good for you, it's just that you've got to evacuate and get that stuff cleaned out. So, what is constipation? Why would you think you're constipated? Well, if you're not having a bowel movement on your own, complete, where you feel like you've dumped at least once a day, I said at least once a day, then you are by definition constipated. But if you go and look up the definition in medical science, they say, well, you have to have at least 3 bowel movements a week. No, my friends, that's not the deal. Three bowel movements a week is constipation. That stuff needs to get through. Once you break food down, it gets into the large bowel, it starts putrefying, it starts rotting. You've got to get rid of it because otherwise all that stuff is reabsorbed into your body. So when we understand that this stuff is not good for you, so what can it cause? Well, it can cause a lot of things. And one of the things that can cause is the potential for degeneration and destruction, but also tissue breakdown, which is often what? It's called cancer. So there's chemistry that begins to form in the lower bowel that you can't rid of. One is called imbudol and skatol and so forth. And your body absorbs this and it irritates tissue. And that irritation, now combined with other predispositions, can in fact trigger problems that you don't want to deal with. And, there's ways of making sure that, this is not part of your lifestyle. We don't want you to suffer with this. We don't want you to have that ongoing problems. But if you look up irritable bowel syndrome, and it's going to tell you it's a very, very common disorder. And it's, portrayed by belly pain. It's going to be portrayed by heavy duty constipation. It's going to be bloating, and then it can go into diarrhea as well. Interesting, right? So all of a sudden your body's going to boom, it's going to get rid of it if you're lucky, but then you got diarrhea for a day or two. Then it goes back into constipation. And then they're going to tell you, well, you just got to change lifestyle, but they don't really tell you how to do it the right way. So you begin to perpetuate, the condition. So if we were talking about just talking about foods, then we're going to say, okay, let's take a look at, is this person a drinker? Is this person a smoker? Do they eat any fruits? And when I talk about fruits, I'm talking about things like blueberries and grapes and cherries. These are things that are really, really good for you. Do they help you move your bowels? Do they help you poop? The short answer is they can, but you don't want to rely on that. It wants to be part of, an ongoing problem. Constipation is not a joke, my friends. It's one that can make you very sick and keep you sick for a long period of time. If you're trying to help yourself and trying to really resolve the problem, you've got to make sure that you get regular again. Now, here's one of the things that I see all the time. Patient comes in and they have structural pain. They have back pain, anywhere from, their waistline, their hips, all the way up to where the rib cage meets. Now, why does that trigger a thought process that may finger point to a constipation problem? Simply because of the fact that these nerves that come from that part of the body go directly to the gut. They go to the large intestine. They go to the small intestine. And they trigger part of the process called peristalsis. That means your bowel movement and get things through. So, it's easier, to have a good bowel movement if you don't have back pain. And a lot of people won't go to the bathroom because of the back pain. And because if they bear down, they push and so forth, they get pain. Well, you're doing it the wrong way anyway. And there's ways of modifying this. I'll give you a little quick sample. If you sit and drink a big glass of warm water before you go into the bathroom, if you know you're constipated, then elevate your feet maybe about 4 or 5 inches off the floor. So you're bringing it up, right? And so that will cause a more direct movement of the intestinal system. And then sit there and rub your belly from the lower right, going up to the upper right, across the belly, and then down the left. and just lightly stimulate that. And then each time you do it, you might go a little bit deeper and kind of finger wiggle as you go through and bring it all the way across. That can help. But that back pain that you have when you're sitting there and you bring your knees up a little bit will relieve it. It opens up the lower portion of your back a little bit while you're sitting there and allows the nerves to have a little bit more trigger. We talked about grapes, we talked about blueberries. Well, blueberries are high in fiber, which helps maintain regularity in the digestive tract. And they're really good for you to begin with. They have high levels of polyphenols, and they help heal lots of stuff in the system. And grapes are great, for battling constipation, but they also have a lot of fiber, and they also have a lot of water, right? So guess what you need? You need a lot of water. So if you're going to get, besides water, you're going to eat some grapes and you're going to eat some blueberries. And how much do you want to eat? Well, maybe you want to get at least a half a cup to a cup of those a day, split it up over the day, a little bit here, a little bit there. Things that have a lot of sugar in them, and I wouldn't eat them heavily on an ongoing basis, but raisins, and prunes, those kind of things will help. Raisins are a good source of fiber, and they can really move things. Put them on buckwheat, put them on stone cut oatmeal, and it'll help with a little sweetness, but it has a good fiber content. We're not saying overdo it. Even cherries, cherries, if you get black oxheart cherries, it's good for your gout, by the way. But it has, it's got a lot of fiber, but it's highly anti-inflammatory. It's got good vitamins in it, particularly vitamins A and vitamin C. And so you have those things. We touched a little bit about prunes and dates. I love dates. I just don't eat a lot of them because there's a ton of sugar in those things. But if you eat, a couple dates, and that's what your source is, you got to make sure you're moving a little bit. And some of you don't get off your butt. You don't go for a walk, and you need to move. You've got to do other things. You've got to stimulate the body's movement. Chia seed, by the way, is a great high fiber component. You can put it on anything, any of the cereals that we talked about, the hot cereals I just said, the buckwheat and the stone cut oats and so forth. Really does a nice job. Papaya is another one. So, we're talking about things like that. The old cliche, eat an apple a day, keep the doctor away. Well, the reason for that is the fiber, and the fiber is called pectin. And it turns into short chain fatty acids in your gut, increasing the level of something called butyrate, which is necessary for the gut to work properly. And those fatty acids will pull water into your colon and often soften your stool so you can poop better, right? So, and making it easier to pass. Figs are another great one, and so forth. So there's a lot of things you can do. Kiwi, if I remember, spinach also, it has a lot of magnesium. Magnesium will make you go. We're going to talk a little bit about that in the live stream after you leave here. I'm going to tell you which magnesium works the best. Artichokes. I love artichokes. And, you sit there and you eat them. And I remember when I first started dating my wife, and she came to this dinner that my grandmother was setting up, and she was offered artichokes. I didn't say anything because I know she never had them before. So you take the leaf, right, and then you use your teeth to clean the inner piece off. Well, what she what she did is she started chewing on the leaves, and nobody said anything. We just let her struggle through it. And then I looked at her and I said, "Watch me." And I'm surprised we got married after that, because that was not the way it was supposed to be. So a lot of things, beans and Brussels sprouts, and if you want to keep the gut really in a good place where it's going to work and kick into high gear, sauerkraut or kimchi, it works really well. And nuts. What kind of nuts? One of the best nuts with high levels of omega fatty acids is walnuts. And so there's a lot of things that you can do to protect and to help yourself. You just have to take the time. Now, when I went through that whole list of things, most of you said, I don't want to eat that. Why would I want to eat those things? Because they're good for you, and they actually taste really good. They have a great flavor to it, and they're natural to the body. So if you did those things and you started drinking enough water and you went for a walk every day, walk. Oh my God, that means you got to get up and go do something, because I sit on your butt, right? Well, walk means that you get up in the morning, you have a glass of water, you stretch a little bit because you're fatigued and brain dead, and you go outside and start walking. You walk 10 minutes away from the house and you walk 10 minutes coming back to the house. And then you extend that. You go maybe 15 minutes out and 15 minutes back. You only need a half hour ultimately. And then maybe at the end of the day, after you have dinner, instead of getting up and going crashing on the sofa, go out for a short walk. The Asians, have you ever noticed, a lot of our Asian Americans that are around here, that they walk constantly, slowly, and, they have their hands generally behind their back because they're opening up their whole body's yang pattern, and it begins to stimulate the body's capacity to be able to dump toxin and to be able to clear all kinds of things out. So, and take your water bottle with you. So when you're out walking, you can replenish that dehydration with water, putting a little salt in it. Remember, I said about a quarter of a teaspoon of salt, and using Celtic or Himalayan salt or things of that nature. You'll find that just doing little things like this makes a difference. And when we go into the live stream, I'm going to tell you how much magnesium to take and which magnesiums are the best to solve that constipation problem. All magnesium works, but which one's the best? Well, I'm going to tell you that when we go to the live stream. It's really easy to do. And then also vitamin C. And we're going to tell you a little bit about that. But it depends on how much you take and what you do with it and so forth. Many of you are constipated because your gallbladder and liver are not working the way it's supposed to. And there's ways of clearing those things and making a difference. So join us on the 20th at the Roselle Center for Healing. I'll share some of those things with you. But here's the piece that most people miss. One of the primary causes of constipation is low back problems. It can be painful. It can be just tight and stiff, but habitually that way. And particularly with guys who are drivers all the time, long haul truck drivers and so forth. And I've seen it repetitively. Or people who have very endowed midsections and are putting a lot of pressure on their low back. When those vertebrae lock down, ain't nothing going to move. It's a really difficult situation. And because those nerves go to the bowel, they go small intestine, they go large intestine, and they're not going to be stimulated because those nerves are being crunched. In the initial stages, they're irritated, and you may have a little bit of diarrhea or a little bit of cramping and a little bit of mucus and so forth. But afterwards, as time goes on, everything stops moving. And so you have to make sure that you are aware of that. Don't put up with your back pain. Go see somebody who does the kind of work that we do at the Roselle Center, and see one of our brilliant doctors if you got back pain and get it taken care of. And maybe you're just going to open up. You can change a couple things. You get rid of the back pain, your bowels start moving, your head starts clearing, little changes in lifestyle. And guess what? You are going to be healthier for it. You're going to feel better. Your body's not going to be restricted. But, it takes a decision. It's a decision on your part. But I'll walk you through it. Send me a note. When you listen to the program, if you have any questions on anything, you can always reach out at drtomroselle.com and just send me a note. I will respond to you. I'll answer you. And, if you need somebody and you're listening to this, you're way outside the area, you need a referral, I'll make that happen as well. I'll tell you who I would send my family to. I'll tell you, who are the best of the best in your area. And you get it taken care of. It's not okay to put up with, because it's just going to make you sick. It's going to give you problems that you don't want to deal with. And if that gut, that intestinal tract is not moving, you increase your risk of all kinds of things, including cancer. And we definitely don't want to have. So join us on the 20th. Now, we're getting ready to go to the live stream. So make sure you join me. I'm going to get into this a little deeper, if you will. We're going to tell you what to do about certain things. And all the information is there. By the way, if you go to drtomroselle.com, the old podcasts and the old live streams are there for your viewing. So join it and share it with your friends. Okay, let's go. You ready to go? Remember, I'm here every Sunday. One reason only. I love you all. Let's go.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Constipation When the Going Gets Tough on Wednesday, August 20th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.